Hello, everybody, and welcome to Western Sydney Community Forum's interactive live stream forum. It's good to have you here today. We do have some echoing. I'll just sort those tech issues out. Here we go. So my name's Billie Sankovic, and I'm from the team at Western Sydney Community Forum, and I'll be your host for today's session. So I'm on Dhungel land in southwestern Sydney, and I would like to acknowledge the traditional custodians of the land that I'm standing on, and also on the many lands that you're all standing on today as well for this meeting. And I pay my respects to elders past, present, and of course future. Thank you so much for joining us today. Now, many of you may be aware that the interactive live stream forums that we hold are really an opportunity for us to come together and to share information and tools and resources. But importantly, they're also an opportunity for us to come together and discuss priorities now as we're experiencing them, and also into the future. And I know that it's a great time of uncertainty, and we certainly didn't expect to be here as we are now. And I want to recognise the extraordinary work that's going on in the grassroots, on the ground, to support each other as a sector, and also to come together as a community to address this spread and to move forward with vaccinations as quickly as we possibly can. So I've had both my doses because I'm in that sort of age group that has had access, and I'm feeling strong. I'm feeling really healthy, and I really encourage you to speak to your sort of chosen health practitioner as soon as you can, if you haven't done so already, and really to take advantage of some of the vaccination hubs that have been set up across Greater Western Sydney. And a shout out to Southwestern Sydney Local Health District and Western Sydney Local Health District and Nepean, who are doing a really fantastic job getting out in the community. Look, what we know is that we're most successful when we bring vaccination hubs to people, not when we send people to vaccination hubs. And we continue as the regional peak to share that message at every opportunity, at the local, at the state, and at the federal level. So, of course, the other thing we know, and this is our topic for today's conversation, is that people are overwhelmingly turning to local, place-based, trusted community leaders and groups and organisations for information and support. And this is, of course, not new to us who are on the grassroots, who work so closely with communities. But what we've seen is that it's become sort of starkly obvious to all in the last several weeks, and particularly to decision makers. And I think that from my perspective, that's certainly been really pleasing to see. And we know that those community leaders are working tirelessly on the ground, and it's critical that they're supported. So I'm really looking forward to unpacking that today and hearing from our panellists and their expertise about what works, what their experiences are, and how we and our organisations can support community leaders and how we can play a role. So before I do introduce our panellists, I want to remind you that this is an interactive session. So we really encourage you, if you're in the room here with us today, we really encourage you to raise your hand and to share your questions or your comments. If you are joining us from in the live stream, we are monitoring the live stream. So we also encourage you to submit your questions through there, and we will certainly bring them into the room. So thank you again for joining us, and let's start. So it's my pleasure to introduce our panellists today, and I'd like to introduce Randa Kattan. Randa is the Chief Executive Officer of the Arab Council of Australia, and Randa's certainly been key to shaping the work of Western Sydney Community Forum for many, many years. Welcome, Randa, and thanks for being here with us today.
Thanks, Billie, and hi, everyone. And I too would like to acknowledge the traditional owners on which we meet today. I'm in the Darug land, and I acknowledge elders past and present. I'm very pleased, and those emerging, of course, and I'm very pleased to be joining you today. Thank you, Billie.
Thanks, Randa. I'd now like to introduce a friend of the forum and an active contributor, Dhungel. Is the founding president and senior member of the Association of Bhutanese in Australia in Sydney. Is now a consultant, actually, with a focus on community engagement, and he certainly offers his services as a trainer and mentor. Thank you for joining us today. Great to have you here.
Thank you, Billie. And I'd also like to, extend a very warm, and pleasant afternoon to everyone who is joining us this afternoon. And I'm also like to start by acknowledging the traditional custodians of the land where we are all meeting, and pay my respects to the elders past and present. And before we get into the discussion, I may also, extend something for the Afghan friends, given what's happening in Afghanistan. I would like to send our thoughts and prayers to people in Afghanistan and our Afghan friends here in Australia. And having experienced the, pain of leaving my own home country, I always hope and pray that, no one is forced to leave their own country. Thank you.
Thank you, for those words, and I know that we all join you in those thoughts, and I know that it's been all-consuming for me, certainly in the last several weeks. So thank you for that, and great to have you here and to hear from you. And I would also like to introduce our third panelist, Dr. Sen Amores. Hello, Sen, and welcome. Sen is the founding president of the Alliance of Philippine Community Organisations, and Sen is a longtime friend of Western Sydney Community Forum and indeed one of our ambassadors. Sen, great to have you here and welcome. Okay.
Sen is on
You're
mute.
on mute. I think yeah. There we go. Welcome, Sen.
Yep. Okay. Thank you very much, Billie, and the other panelists today, as well as all these who are participating with us. This is a very important day for our communities, different communities, especially for people who have been, I would say, struggling because of the effect of this pandemic. And just like my co-participants in this session, I also would like to acknowledge the traditional owners of this land in which we are meeting today, and pay my respect to their elders, past, present, and also the communities that are emerging. Thank you.
Thank you, Sen, and thank you so much for being here. Thank you, all of you, for being here today. And certainly, can I just recognise from the outset all the work that you've been doing to support communities. And I spend most of my days on the phone or video conferencing, and I'm continually hearing some really powerful stories about the inroads that you and other community leaders and groups are making on the ground. So can I acknowledge that, and obviously thank you for all the work that you guys are doing, because we're the forum. Without the work that you're doing on the ground, we just wouldn't be able to have that level of reach. And I also want to acknowledge Randa, Sen. Thank you for coming in uniform. We're all in red. What happened? You forgot your red.
The odd person out here. Just standing out.
Yes, the only rose among the roses, they say.
You should have sent that instructions to me, Billie.
Yes, it wasn't in the briefing. Actually didn't plan it for everyone out there. So we all turned up and we're all in red, and what the heck, But here we are, trying to brighten our days or show our
Why not? Passion.
I have the background, Billie, so that should brighten up the day.
Y'all got the border on. Well done. Well done. Look, to start, can I ask all of you, and Randa, we might start with you. What's been some of the challenges you've faced during this outbreak as a community leader, and what are you experiencing on the ground?
So, like everybody else, I guess we watched the cases mounting. I think, and we're obviously anxious and terrified that it's going to grow and grow. And as we have seen, today is the highest that we've seen to date. But what's also been quite concerning to us is the way Southwest Sydney and Western Sydney have been treated on a daily basis in relation to, we're all, I'm sure everybody on the panel and everybody who's watching, mesmerised by the daily press conferences. And at times we have been quite disturbed about the messages that are being levelled at communities in Southwest and West Sydney. Now, it's been divisive, it's been a heavy-handed approach, and when I say a heavy-handed approach is that when the police were deployed into the area, and as we know, the area has always had a particular attention where we find that we are strong-armed into obeying the law and order approach was being consistently applied over the years in areas like Southwest and Western Sydney. Communities are quite vulnerable. They come largely, not many people work at home. People have to get out of their, they have to go and earn a living, and largely they're blue-collar workers. So the concerns have been in relation to the messaging that have come out, and particularly with the senior minister, Minister Hazzard, like reprimanding the community, talking down at communities, weaponizing the word multiculturalism or multicultural communities, heard it over and over again. And also when the police were deployed, followed by the army who came into the area. Now, what happened afterward was corrected somewhat, but already it's out there. And what happens with communities when they are watching and they are being blamed for mistakes, not of their doing. None of this is their fault. They basically have been, they're following the rules largely, but they're hearing on almost a daily basis, every now and then, that they are being blamed for something they don't know. When the messagings were at the very beginning, they were extremely confusing. It wasn't lockdown, was not a lockdown, stay home orders, don't stay home, please do this, but don't do that. And it was extremely confusing, very nuanced messages that at a time like this, we need to feel that we've got strong messages coming across. We need to feel that there is a government there to protect the people. The message, the government is clear. People will have the confidence in following orders. But at the very beginning, there was no such messages coming through, and people were confused, and rightly so. When you look at another part of Sydney that are going and promenading around the beaches and going and looking at beaches, and here people are locked in their homes. They are told to stay home, and it is their fault if the infection rates goes up. So people were absolutely anxious. And on top of that, when the lockdown extended and extended and extended 1 week after another, and the infection rates started going up, people are feeling hurt. Not just hurt morally and socially, but also hurt financially. Absolutely terrifying times for communities. When you see bills are mounting and then government saying negotiate this, moratorium that, and doing that, people are not capable of negotiating their bills. Bills are still mounting. And what are we going to see as a result of all of this? What is the end of it? How are people going to be supported? The financial assistance that came through is nice, absolutely confusing. Not many people are able to access them. And when they do access them, it's not the full amount. It's not like it has been, told. I was told by the Prime Minister as well that people can immediately access the disaster payment, but it is not the experience on the ground. It is very confusing.
Yeah.
And, I could go on, Billie.
Oh, I know. Yes, and these are common to the stories that I'm hearing, Randa, and they're just characteristic of the challenges that community leaders are facing on the ground, and not just the basics of trying to make sure that people have enough income to feed their families and to pay their bills now, not later, but then also dealing with the pandemic, and it's just been so difficult. And look, thank you, and we'll get a chance to unpack some of those that you mentioned today as well. What about you? I mean, what are your experiences, and what are some of the challenges you've faced during this outbreak as a community leader?
Billie, talking about challenges, there are a lot, and there are many challenges, definitely. I might sort of go back to when this started happening, last year, and I might just touch on two main challenges. Firstly, it was the challenge of the disruption to normal day-to-day life, and the immediate, reaction to it with the fear of the unknown. What's going to happen? What it is? We really didn't know, like what it was initially, whether it was just another flu, or was it something more dangerous. However, one thing we knew very well was that our lives was totally disrupted. And that's where people were very uncomfortable. And some sections of the society were hit harder than others. And say, for example, like, our seniors used to, meet every Friday at Sidwest in Blacktown. And when this stopped, like, say my parents were both in their 90s, and my dad is 94, mom is 90. And similarly, there are others, in their 90s and 80s. And they said, oh, we don't go to Sidwest anymore. How do we meet each other? So we knew that, they were impacted. First week, no Sidwest. Second week, no Sidwest. We thought, okay, I was very worried. I was talking to all of these seniors in the community, and that was very worrying. So we said, okay, let's, do something about it. We started video conferencing. So the video conferencing that we started 2 weeks after the lockdown last year, it's gone on and it's expanded now. Actually, it includes more people from from within Blacktown, but we got people from Penrith joining. People who are not very well are also able to join from their beds. So that's been one of the fantastic sort of outcome of this. And my mom has started using Messenger, and like she's able to press the button and do it now. So we are having a bit of a digital, education as well. And a lot of seniors are now actually learning, because one time, like, one of the elderly person was not in there. We said, what happened? Oh, my sister-in-law was busy. I said, why not you try? So we started giving them homework, next week you got to teach the, your grandparents or moms to do that. And that has been one of the most, successful outcomes from this COVID, I guess. Now, following from that first sort of challenge, the other major challenge was to remind ourselves that life never happens 100% the way we want. All sorts of challenges are thrown at us all the time. And, I can recall quite a few of those, having left my 2-year-old daughter and, run away from the country, become a refugee, etc. So life always, throws things at you. Yeah. But I think what is entirely up to us is to how do we respond to each of those situations?
Yeah.
And we have the freedom to choose that response, I found, because if we didn't choose that response, I wouldn't be here today. When we became refugees, when we were, struggling to survive, I think it was a difficult time, but then we had to choose to take a response that we wanted. And for our community, I think it was revisiting that experience about 30 years ago, that, the experience and the learnings from that experience of becoming a refugee, where we had to look after each other. And, like for the very survival, like, we had to look after each other. So in such an emergency situation, like what we did was we had to really start by thinking, what can we do?
Yes.
And we started that conversation. And how can we look after each other? We even started this conversation in Blacktown with colleagues from the African communities, South Sudanese communities, various other multicultural communities here, and started having that conversation to take care of ourselves. And I think
Yes.
for me personally, it was also reaching out to fellow community members and community leaders from across communities, exploring what can we all do together.
Absolutely, absolutely. And, I'm really pleased that you sort of talked about some of those, really those opportunities that have emerged in terms of building digital skills and things like that, because there are some really, some of the stories that I'm hearing of the resilience and the compassion at the local level and people coming together have just been really inspiring,
Amazing.
over and over. It's the grassroots where we're having the most influence and impact, I just think it's so important for us to emphasize that it doesn't happen. I mean, I was on 2GB the other day, and I was saying the personal is the political, right? And absolutely, the decisions in Canberra and in Macquarie Street in Sydney impact and shape the way we live our lives. There's no question about that. So we need to be thinking about that. But those local stories of efforts, community efforts, have just been so inspiring, So thank you for that, Thank you for sharing that. Sen, tell us, how's it been going for you, and what are your experiences on the ground, and what are some of your challenges?
Just like I would like to start with the experience that we have had last year, when so many were so down and so frustrated, stressed out because of the sudden change in the way they have to live their lives. And among those that touched my heart was the group of international students who were not prepared to accept that the reality that they no longer have their source of income. Their part-time job is gone. Some of them, they brought their families with them when they came over from overseas, and they have nothing, no food on the table, because many of them were not able to establish their own support network. And among those were those affected are the newly arrived international students. And that's when we thought that we have to do something. There must be a way by which we can really help out all these very vulnerable people. And one day when I went to my beauty parlor, I was talking about the idea of what can we tell me, how can we help these people? And my dietitian said, look, there are many of us in the Berala and Auburn and Lidcombe area who come from the Philippines. Why don't we organize ourselves so that we can provide more assistance to our own people?
Yeah.
So basically, it started with just our own people. Okay. Yeah. And we discussed more about it, and we started identifying people and groups that we can work with as a bigger group.
Yeah.
And so you contact this person, you contact this business here, you contact this church here, you contact this community organizations and so on. That's how we started. We didn't start working individually. We started by putting together, harnessing all the resources that we have from a very loose network of community organizations from different backgrounds. We also had a few charity organizations that we contacted, and then multi-faith, about three churches that we involved, as well as the other groups, the other charity organizations and people that we know who have the experience of helping, and who have the commitment really to work in a team. And we did not lose time, because time is of the essence. So I called for a meeting we organized the meeting of all these groups, and they were all excited to attend. And we said, what can we do? So what we did was we started planning straight away in the first meeting. We started planning what we had to do, something concrete that we can deliver as soon as possible.
Yeah, and I, sorry,
yes.
Sen.
Okay, and we formed the Multicultural Assistance Task Force. That's how we called our name, because we were there. We were formed primarily to respond to COVID-19. And in 2 weeks' time, we were able to organize the first distribution of essential goods, as well as relief goods, because it was during winter time when we established this loose network, and many of the international students were not prepared because they were not prepared to have their winter wear. And so we also tried to approach more people and groups of people. For example, I would like to acknowledge this group of Vietnamese women, Vietnamese seniors in Canley Heights. They provided us with truckloads of clothing, blankets, comforters, jackets, and so on and so forth. So we were able to organize it in such a way that people were there, and they brought along as well. They brought along their own members of this and that organizations. There's about 21 groups. That's
wow, that's huge. So
look,
we were, and then you just described exactly some of the stuff that I'm hearing, not just from your community, but across a whole bunch of different communities. And also what you've just emphasized for me is how important it is to have these structures in place and supported, and how important it is for us to recognize, I guess, community development back to grassroots, and how that needs to be supported publicly. So look, we've got some questions coming in already, which is fantastic. So please, everybody, if you're listening, please raise your hand and we'll bring you in. And if you've got some comments or some thoughts you'd like to share or any questions, please feel free to raise your hand. But we do have a question I'd like to share with the panel from Michael Thorne. Hi, Michael. Thanks for the question. Michael said, is there an ability for Western Sydney community organisations, so organisations like yours and also the others, to increase advocacy for a community health response to this outbreak rather than this sort of overly compliance-based approach, which seems to sort of be the emphasis at the moment? So does anyone want to make any comments around that? Or Randa? Yes, go on.
Absolutely, there is, and that's something that we have been calling for. And we've been calling for at different meetings, directly with politicians, directly with various structures, without naming the agencies and so forth. We've been raising it directly with them that's how it needs to be. As I said at the beginning, the unfortunate thing, it started off that way. Very hard to back it up right now. Nevertheless, the compliance issue right now, it is no longer a health response. It's becoming a compliance response. So together with lots of organisations through the Sydney Alliance, I've been lobbying everywhere. Trust me, like with government, with community organisations, with the unions on different fronts as well, and with other community organisations and politicians directly. But together with Sydney Alliance, we came together and we're calling for a number of things. And Sydney Alliance, through our combined organisations, whether it is those who are partner organisations in the Alliance, those who are outside the Alliance can still join the campaign, representing about at least 2 million people across Sydney who are calling for a number of things, calling for consistent messages across that it is a health response, of course. What we want is to reduce the infection rate. We want
Yeah.
people to be vaccinated, to be safe. But
Yeah.
what we also want is consistent, respectful messages across the entire Sydney, New South Wales, Australia, everywhere. Not this division between one local government area and the other, but also to support the people. So in my own words, I would say, lock us down and pay the people.
Yeah. 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 Yeah.
I mean, it has to be that way. There is no other way. I think, people get vaccinated, get tested, comply with the rules, of course, but it only can happen when people trust governments. And it can happen consistently when people trust the government. If they trust the messages that they are being told and consistent messages at that, then people will comply. And people largely, and it's been admitted on a daily basis, although we hear the number of fines that are being issued consistently, it is largely 99% of the people are complying. Of course, you're going to find the odd person not complying, not the issue.
That's right.
Yeah, not the issue. But we need to support the people, of course, financially as well.
Yeah. Look, Michael has just popped in another question on the back of that saying, can there be details for the Sydney Alliance campaign so we can share that? Michael, look, absolutely. We'll send a link through our chat to Sydney Alliance for all of you to see. And sorry, through the Q&A, not the chat. And
can I say one other thing just in relation to the Sydney Alliance? People, organisations, please join, call on other organisations to endorse the statement. You will see the proposal right there. And I think Billie and team from Western Sydney Community Forum, they've already joined, but please, multiple organisations just join the campaign.
Yeah, thanks for that, Randa. And look, what we know and what we've seen is that backing sort of local place-based trusted community leaders and community groups and community organisation is far more effective than enforcement and sort of punitive measures. We know that. Sen, do either of you want to make any comments in relation to that?
Yeah, I agree with Randa. We are also involved with the Sydney Alliance as community organizations. This Sydney Alliance has been working for a long time, advocating for the common good of the people in Sydney. And they have a lot of advocacies that they were able to successfully support, and got a lot of support from different groups, from the professionals, from community organizations, church leaders, trade unions, and you name it. Why? Because they have a very strong leadership that really delivers what they say, not only what they do, and you see the impact on the people who are affected by that change that they really are asking for.
Look, thank you for that, Sen. Look, we've got more questions coming in, so I'm going to bring another question into the room, and I might throw that one to you first. So we've got a question from Hazrat. Hazrat, can you join the room and ask the question?
Hi, Billie. I actually had a question for Randa, but I guess anybody could answer it. Just on the comments that you made early on, Randa, about the divisive messaging from government when it first started and, you know, the ongoing lockdown, I'm wondering what you feel the impact for communities will be once we come out the other end, and how we will continue to support them, especially given our communities in Western and Southwestern Sydney coming from refugee and migrant backgrounds who have probably already experienced trauma in their life.
Thank you, Hazrat. That's such an important point, and I'm glad you raised it. Randa, I'll come to you, but I just do you have some thoughts about that around Hazrat's question around the long-term impacts?
Yeah, Hazrat, thanks for that question, and I think this is really, really important. We really have to think of the long term, because we are Sydney. We are not Western, Northern, Eastern Sydney, because we keep moving around ourselves as well. So if anything divides us is like detrimental for all of us. It doesn't benefit anybody. So I think as, someone who sort of steps forward to lead or be part of a leadership group or discussion, one of the things I look at is, would it help us in any way? It will definitely not, because I've got friends who live in the north. I've got friends who live across Sydney. So basically dividing that. So if anybody or the media wants to pull, words out of a prime minister or a premier or a thing, or, like everything, like I can see the premier and like, when I'm talking now, she is busy somewhere. When I'm sleeping, she's still doing something. When I get up, she's still doing something. When I look at her face, she is a human being as well. If she drops anything, the media will pick up something and magnify that. So our role is, yes, there would be mistakes, or things will go wrong. But we as community leaders, how can we try and, do everything possible not to, allow that to, mitigate, like, or expand further. So the way we can sort of perhaps help is, if there is a conversation happening in the social media, for example, how can we stop, like, if there's so much negativity around there, like, would we allow that to flourish further? Or if we just stop that conversation and lead it to a different kind of conversation, it might help. So the way I approach this is, I don't agree on any division within the community, because it may have political reasons or whatever reasons, but, I've got friends from all over the place. I've got, friends from the, Fairfield area where I work so closely with, Liverpool area, and like you talk about Sydney, everywhere. So for me, it's one, and I'm a Blacktown resident first, Fairwater resident, Blacktown resident, and Sydney resident. So that's how I see no division between different people or groups or suburbs. So I guess this is how we are approaching, because it is not good for the community in the long term.
Yes, absolutely.
On my part, I believe that there is a unifying factor. It is important that people will really express their sentiments and their ideas, share it with as many people as there are who are really like-minded like the others. It is only, I think it's only through people working together for a common goal, for a common good, that would really be a factor for us to consider if we really want something good that will happen as a result of this crisis that we are in. So there are a lot of resources that we have. There are a lot of people from, not necessarily coming from different places or whatever, but we have to open the communication for everybody to speak their mind, to make suggestions on what's the best way to go forward.
And have a platform, right, for that to happen. There's just been a couple of comments that have come through before I hand to you, Randa. So Jackie Parker, thank you for your comment. She says, in quotation, of course, consistent messaging and pay the people, the basic human rights, and such a simple and essential request. Yeah, absolutely, Jackie. And Margaret's also commented, Margaret Tipper, thanks, Margaret, good to see you here. We need to start developing a long-term recovery program for all parts of life, particularly with children and young people. There are signs of agoraphobia developing in young kids that are getting scared to go outside. So some really, key considerations. Randa, you had some thoughts as well in relation to Hazrat's question?
Yeah, Hazrat, thanks for the question. And yes, I do have thoughts, of course. I recognize that the Premier is a human being, of course. And I feel for her and for the long hours that she's spending. And it is so not an easy thing to stand in front of the media on a daily basis, particularly to kind of face the media and tell us the horrible story, the horrible increasing in numbers. Of course, I feel. But at a political level, I disagree. By that, I mean the messages, I don't mean politically party politics. I'm talking about the messages that are leveled at communities. We don't need to twist it and turn it back onto communities that they are to blame. Communities are not to blame. Communities are doing their utmost to do the right thing. And they absolutely, we call on everybody to follow the health orders. And it needs to be a health message. It is not a political message. It is not a law and order message. It's a health message. We need to protect everybody, and everybody needs to follow those orders. And for the sake of ourselves, our children, our grandchildren, our families, our communities, and Australia-wide, and the world, for that matter.
Yeah.
So we need to follow the health orders. Having said that, in terms of the impact on communities of divisiveness, we've been here before. So we have been here many times before. I still remember in the 90s what happened to us in the 90s in the West, in Bankstown and Lakemba and all those places, and Cabramatta and so forth. I remember it very clearly on how we were approached. It took us years to get to a point where people can start trusting police, can start gaining trust a little bit in the system. Okay. It took us forever to try and rebuild those relationships that were lost. So right now, the relationships are strong, but it doesn't take much to topple people's faith in systems and in orders and so forth. They're quite fragile. So all of us, it is incumbent on all organizations, first of all, call it out when it's needed, call it out respectfully. When there are messages that are divisive, this is not what we stand for. We stand for Sydney, we stand for New South Wales, we stand for Australia, we stand for humanity. And that's what we call what we want to call for. We don't want to call in divisions. We do not believe in divisions. Call it out, bring, make yourself known that this is what you are opposing, because it is not helpful. People need to feel respected. They need to feel valued. We're not, we're not mugs. We understand it. We understand the messages. We understand how it's coming across, and what affects us affects everybody. And particularly some groups, we are much more likely to feel a collective sense of blame and shame, and we don't feel it on an individual basis. We feel it on behalf of communities. And right now, I feel for Southwest and Western Sydney. Tomorrow, I probably feel for the entire world, but today I feel for Southwest and West Sydney. All communities in there. And across Sydney, of course. And I don't want to, this is by no means, it's not a divisive message. And in relation to the long-term recovery plan, that is also one of the demands that we put in as part of the Sydney Alliance call for proposal. And the reason also why, it's good. People join the call for those. If you read the proposal, it's one of the long-term things. So whatever decision we make today, we don't want it to impact on the people in the future. So whatever governments take decisions today, we need to be mindful of the fact that they've got long-term repercussion. So we need to call for sensible conversation together with communities. It cannot, governments cannot sit behind closed doors and make the decisions on their own. They need to engage the communities. They need to bring the communities together with them. Thank you.
Yeah, no, thank you, Randa. Absolutely. Some really important points. And we've got more questions coming through, and I'm just conscious that we don't actually have that much time left. It's one of those topics that you could talk about for a long time. So I'm just going to turn to the questions. I'm going to send this one to you. We often hear that this is from the room, we often hear that volunteer community members are doing a lot of the heavy lifting in regards to health messaging. So it relates to what we've been talking about. So how do community organisations support our community leaders to continue to do the work that they're doing?
Okay. Firstly, I think I might just jump into how we approach this, with real examples, so that it's so much easier to sort of explain. So when this happened, we saw that, nobody was really prepared for this. Nobody saw this coming, at least the magnitude of it, nobody knew. So we started looking at what can we do. So again, started reaching out to community members, calling them and say how you are doing, etc. And to complement what the government's efforts, like for example, the Bhutanese community and the wider communities that I'm involved with, we have actually embarked on a virtual door knock. And what it means is, when I said door knock, I was almost reprimanded. You can't do a door knock. And I said, it's a virtual one because we pick up the phone and make a phone call. So call that a virtual door knock.
Yes.
It's sort of following a pyramid scheme of calling 10 people and inquiring about their well-being. And also asking them, hey, can you call 10 other people? But then given that, we had issues, people have talked about the issues with messaging, etc. We said, okay, how can we simplify this? Because I go back to my school days and where we studied simplification. And that's one of the ways I have dealt with many of my problems in life. How do you have a bigger problem? How do you simplify this? Even here, we started looking at for our community, for the communities that we work with, how can we simplify this? So we thought, there were 3 key messages that we had to get it through, like having a translated material or whatever wasn't even getting to where it needed to be. So we needed to talk to each other. But what were the 3 key messages for us was, 1, follow the lockdown rules. Even if you are vaccinated, you cannot go out. Secondly, on that, even if, it's your family. Sometimes people thought that, you could go around with your extended family. No, it's your household. So getting that message very clear was really, really important. And number 2, getting people to be vaccinated. Again, a lot of people had some concerns because they have heard something from friends and relatives overseas, etc. I said, we live in one of the best countries in the world with one of the best health professionals in the world. Do I trust these health professionals or do I trust Google doctors? Because we can all Google and be experts tomorrow. But the thing is, we have the privilege of living in this best country in the world with access to best health professionals. If anybody has any doubts, we can organize a forum like this, invite health professionals and get them all the answers. So simple, number 1, follow the lockdown rules. Number 2, get vaccinated. If any issue, let us know. We can get a health professional to talk to. Number 3, get vaccinated. Get tested. Even if you have the mildest of symptoms. So I think with those 3 messages, I think it's stressing, in summary, sort of stressing that life is more important than lifestyle. Because I found that I've almost, lost my life a few times and realized that we can always have a lifestyle. But if you don't have a life, you can't really have a lifestyle. So I think it's really important for us to, at this stage, to understand that life is much more important than our lifestyles.
Yeah, absolutely. I mean, at the moment, it's so we don't really want to talk about some of those broader debates, but I think that's a really important point. Thank you. We've got more questions coming through. Sen, I might push this one to you. Sidiku Panwala, thank you for your question, has said vaccination is our way out of this. So how can we run an effective campaign to get that message out there?
Okay. Sen? Go to the grassroots. That is very important. Okay, make them feel important, that their contribution to the solution of this problem is very important. We have leaders from different organizations, from different communities that are very reliable, and they have really the ability to communicate well with their own people. Use the different those who come from different places and speak similar languages. Put them together, as well as the examples of the good way by which people have responded positively when situations arise that really calls for action. That should also be harnessed. Use mobile phones, use a variety of ways by which we can communicate with people, and use effective teams as well to help out, to convince people on the importance of adhering to these rules or to the vaccination of people. Unfortunately, there are some groups that, because of their belief, or could be religious or whatever type of beliefs, they refuse to be vaccinated. This is really a challenge for the officials to legislate, challenge for people, especially those who are dealing with vulnerable people day in and day out. They have to be to think not only of their own selves, but also the impact that to the bigger community that they are dealing with on a daily basis. That is very important. Appeal to their sense of, I would say, charity. Appeal to their to common sense, and make sure that they realize that everybody has to look after each other, and to be able to look after each other, we need to adhere to the vaccination as a way of getting out of this dilemma. There could be other ways, but that's a challenge to the leaders of communities to reach out.
And Billie, I might just add that virtual door knock, it's working really effectively. Siddiq, I'll be happy to have an offline chat with you, but virtual door knock is reaching out deeper and deeper into communities. So let's try that, and happy to chat. Thank you.
Yeah, in addition, Billie, I think it's important that the health workers will have to go to those communities themselves and deliver the vaccination in those clusters, rather than putting them all together in one big area where they have to waste so much time waiting, and then later on they find out that there's not enough vaccine after waiting for a long time. That is really causing a lot of frustration from the community, and this is made known through media. So the ripple effect of that frustration builds up and builds up until people will say, no way, let us not cooperate, because they're just making they're taking us for granted. So let them go there. They are paid to do the job, and serve them where the people are.
Yeah. And, I mean, that's a really good point that we were saying at the beginning. You need to take these vaccinations hub to the people. Yeah. And in local communities, in places they trust. Randa, how can we run an effective campaign?
For vaccination, I think the vaccination rates are going up very fast in Southwest and West Sydney, and I'm sure, and it started from a very low base. It's going very well. I think I totally agree. Go into communities, run it there. Now, one other thing I would like to point out, running information sessions to convince the people who are not necessarily a hardcore anti-vaxxers, but more about those who are hesitant, don't know, and whatnot. It is important to run them sometimes in language. So far, the Department of Health is still kind of like they rely on more messaging around English, even though the messages, the written information is provided in various languages, but delivering those sessions is important. So what happened in the Arab community, for example, a few doctors, really wonderful human being, who took it on themselves to start delivering those messages. From community organizations' point of view, it is important that health runs this, as opposed to community organizations or doctors. Nevertheless, they're running it because there is a gap. People have got a need to know. There's still a lot of myths that are floating out there that have to be debunked. So they've been running the things. We've joined in a couple of those sessions where we supported that. There are particular things that, and one of them was for the youth last week. and that was very successful, and a lot of people came in.
Yes.
So the closer we are to communities, there are quite a lot of hubs out there that are delivering, part of community organisations like Woodville Alliance, for example, like the LMA in Lakemba, like the Orthodox down in further down in Campsie. So there's quite a few that are running at the grassroots, and they're having a lot of success. And there is more vaccine right now in terms of Pfizer and so on, and people can access it.
Yeah. And absolutely, Randa, thank you for those examples, and they're exactly the ones that I'm hearing. There's, there's also the Pacifica community. So what's happening and what's working, what we're seeing is that where health is working with community organisations at the local level, and that's where it's happening. And also, I'm glad we talked about the rates, because yesterday some new data was released around the vaccination rates. And what was really clear is that it's areas of southwestern Sydney and other areas of Western Sydney, the vaccination rates are growing faster than any other area. And so, this is really important information. And so we have to really make sure we don't focus in on the myths and the stereotypes. We know that about 95% of children are vaccinated, for example. So that gives us really good information about the level of support for vaccinations. But we have run out of time. And as I said, it's, we could talk about this for a long time. So just to, I guess, if all of you can just share, what is the one thing that's on your mind that would right now, as a community leader, help you to feel supported to do the work that you do? Randa.
Tell others about the work that we are doing, join in campaigns that we are doing. Please do not wait to be asked. Sometimes that we need to ask, but sometimes please don't wait. Just send the messages that you are hearing to other people. And I don't want to take too much of your time because I know we're running out of time.
Yeah.
Join the campaigns, join whatever we're doing, support what we are doing. We're doing it for the people.
Yeah, thank you, Randa. Sen, what's the one thing that could help you to do the work that you're doing?
Okay, this is a challenge for the politicians from the 3 levels of government. Okay, now forget that election time is coming. Okay. I think I am suggesting that the politicians or the officials who man the different levels of government should come together and work out a way by which they can produce more resources to help community leaders deliver much needed services. The financial aspect of working, of providing the needs, the basic needs of our people is very, very important. They can't wait. People can't wait for several weeks before they get the resources that they need, especially for them to survive. And so my suggestion is for our politicians to really approach their biggest donors during election time and ask for help from them, not for themselves, not for them to win again and keep their positions in power, but to put up a foundation where we can, where all these rich people, the friends of many politicians, to put money in it. And at this particular time, we can access those money. It's payback time for them because they have been given so many benefits. I mean, owners of big businesses. They have been given so many benefits by the government. It's high time for them to help out people who are in need.
Well, there you go. That's a very clear and strong message. Thank you for making it, Sen. What's the one thing that would make a difference to help you and your community?
I think I believe we cannot and we should not allow this crisis to go to waste. One, of course, we need to address the current problems and crises that we have at hand. But also we need to change the way we engage with communities, not to find what the problems are, what the needs are, because we don't have a magic wand to solve all those problems. Projects aren't the answers. People are the answers to the problems in the community. So people are the answers. So we have to take a bottom-up approach to the way we do community engagement. Secondly, to Margaret Tripper's point, we need a long-term plan here, long-term transformation plan. So we need to have deeper conversation with people, the leaders that are coming up with solutions. Oftentimes we bring leaders, we tend to magnify problems. But what we need to do is we need to move from solving problems to exploring opportunities. So I think we really now need to start thinking of, I remember like when we were building huts in refugee camps, we were already thinking, how do we dismantle them? So even now, I think we need to start looking at how do we address this problem, but at the same time, what are the opportunities, and have deeper conversation with those leaders who have those vision and work collaboratively together.
Yeah, some really sage advice there, and thank you for that so much, And whilst you're building the huts, you're already thinking about how to dismantle them. I like that analogy. It's people can resonate with that.
We didn't want to live there forever, so we would say, where do we go to? So this is the situation we don't want to be in, but what next? Other issues will come up, other problems will come up, but if you are prepared, if we develop an army of community organizers, build that capacity, we will be much better off next time around.
Yes, certainly. Look, thank you all of you so much for your contribution. And we could go on for a long time, and I'm always go over time, and my team always say to me, Billie, when are you going to be on time? And when are you going to stop talking? I never am on time. So I'm sorry to keep you all here a bit later than expected. But look, thank you all of you. Randa Kattan, thank you, CEO of the Arab Council of Australia, and look forward to speaking to you again soon. Thank you, Dhungel, founding president and senior member of the Association of Bhutanese in Australia, Sydney. Thank you, speak soon. And Dr. Sen Amores, founding president of the Alliance of Philippine Community Organisations. Thank you, Sen, and see you soon as well. So look, thanks everybody for sticking with us, and apologies for going out of time. Over time, as always, we get some really good key messages. And of course, one of the key messages today was that we need really strong leadership. We need future planning, we need resources, and we need to remember that the grassroots is where we can have most impact and influence. I'm really sorry that we didn't get to everybody's questions, and we'll certainly do our best to have a look at those and potentially respond at another time. But if you do have any further questions or thoughts or suggestions, please don't hesitate to contact the team at Western Sydney Community Forum at any time. Thanks so much again for joining us, and stay well and stay safe until next time. Goodbye.